Hi everyone, I'm Wee Bing and I'm with Eiling, the Child Development Specialist. So last week we talked a bit about milestones. Parents were asking us, how do we track our children's development if I don't have the list of milestones, or even if I have, I may not be able to understand how to really follow them. So is there any way we can have an easier way of identifying? So today I'd like to ask Eileen on her opinion and how she can help us with this. Okay, first I will just show um, this PowerPoint question so that everyone can have a look. Okay, all right, Eileen.
Hello, everyone. All right. If you have a child with you, a baby or a toddler with you, as a parent, we will be very concerned about what kind of checklist or what kind of milestone my child has to meet, right? So normally, we use a milestone checklist to help us identify what kind of milestones to to look at and to check if my child is meeting milestones. So if my child is meeting milestones, then I can be assured that these developmental milestones are there to lay the foundation for the next level of development, right? So without a milestone checklist, so how do we know if my child is on track? Now we don't use hearsay, or we don't use because my folks has or my parents have raised a child, I use whatever information I gather from them or from the internet. Now the list of milestone checklists is supposed to be comprehensive, because the brain is programmed to reach certain milestone at a certain time frame. Now, in general, right, if you were to look at a baby, a newborn baby from, say, an infant, a newborn baby, we look at few things like ability to latch, right, ability to feed well, ability to sleep well, and if child or this newborn infant is crying excessively, we need to of course be there to support, because I also have mentioned about fourth trimester, where once they're out of the womb, they are not quite sure of this world, so they want to feel assured. They want to build that bond with mommy, so they want to be carried, because it is similar to what they experience in the womb. So if they have excessive crying from 0 to 3 months, and if the excessive crying affect their sleep, then you may want to speak to your doctor. All right. And only want to be carried from 0 to 3 months is quite common for them to be want to be carried, because it feels like they are still in the womb. But if the only one to be carried extend beyond 3 months, then we have to check, like why, right? Also inactive and uninterested. Now, from the time they are 4 months onwards, we're looking at them like picking up major milestones like rolling over, okay, going on their tummy, crawling on the floor, commando crawling. So if they are inactive or uninterested, again, we need to look at what is bothering them, right? So generally, baby milestones are the foundation for future learning. Okay, so what are the other symptoms to look out for in a baby? Now, we know that baby fall ill, and because their immune system is still building, so their immune system at a very young age is not strong enough, right? So their gut health and their respiratory system, all these are still taking time to slowly develop. But however, if baby fall ill frequently, when we say frequently, is maybe in period of a month they fall ill like um, 2 times, 3 times, then it may be a concern for us to look at like what is the health issue. So again, you may want to seek help from your pediatric, right? Eczema, respiratory, constipation, reflux. All these are common problems that we see in babies, but if this common problem a, becomes something that is bothering your child, like if the eczema is too bad and baby is so red and rash and broken skin, and sometimes I even see blood not oozing out, but like some broken skin. So all these again are issues that you may want to seek help from your doctor, because sometimes it's not a medical issue, sometimes it may be a gut health issue, right? All right, so we're going to look at toddler age group. Okay, how from what age to what age? Toddler, we define them from the moment they are about 13 months onwards. They are toddlers, all the way to up to about 3 to 4 years old. Okay, so 4 years old onwards, we call them preschoolers. Okay, so for toddlers, we look at difficulty in sleeping through the night. So at what age do they sleep through the night? Usually, not often, but usually at about 6 to 7 months, they sleep through the night. And if toddlers are not able to sleep through the night by about 13 months, same thing, we need to look at what are the other maybe reflexes that is bothering them, right? So excessive crying. Now, excessive crying could be separation anxiety, right? Fussy eater also, what is bothering them, and maybe it's not so much about the food texture, could be other issues like the facial oral issues, okay, bedwetting, potty training. All this has to do with their body spinal fluid development. Okay, so drooling, suck thumb, all this again is the hand-mouth coordination issue. Okay, so we look at delay in walking and speech. All these are what we call delay in milestones. So the delay in milestones, again, if we look at baby's development, if all the milestones during babyhood is not achieved, then you probably see a high chance of having delay in walking or delay in speech development. Okay, low motivation, same thing. If baby development is not meeting their milestone in a timely manner, um, they are not going to be very happily playing. So you see the low motivation, or sometimes it might be a little bit on the opposite side where they are hyperactive, right? So when they go off to childcare, or they go off to kindergarten at about 2 years old, 18 months to 2 years old, where they go to childcare or kindergarten, we tend to hear a lot of biting issues, hitting issues. Same thing, all this has to do with their hand reflexes. Okay, so clumsy, poor coordination, tiptoe, and W sitting, all this has to do with their postural control, their balance, their vestibular system. So again, if the milestones in the babyhood from 0 to 12 months, if it's not properly laid down in a timely manner, you will begin to see all these issues in toddlerhood, and all these issues are very prominent, and you may even get complaints from school teachers. All right. Now, how do we determine if there is a call for concern? Is when you see a common problem affecting child's learning and child's behavior in frequent occurrence, and if it's persistent, no matter how much you help them or to regulate them, it still doesn't work, then yes, there's a call for concern. And if you are really unsure, you may want to speak to your doctor or someone who understands neurodevelopment. Okay?
Okay, no, thank you for this, because some of these symptoms that I saw, we often have this common misconception that they are just children being naughty, children going through a certain phase. I didn't know that there's so much neuroscience theories behind it.
Mm.
Yeah. So and these are a gray area between, is it medical world or is it the neuroscience? So I think it's great that we not only look at medical science, because the doctors will help you with the health, but it's really important that more and more evidence are showing that the neuroscience world are actually able to look at these symptoms as well. So, all right. So thank you, Eileen, for your time. We will share more in our next video.
You're most welcome.
Okay, thank you. And if you like this video, please follow and like our page, and we'll bring on more videos for you in future. Yeah. Thank you. Bye bye.